petrochemical foods, the main cause of kidney, prostate, urethritis diseases. The main cause of prostate, kidney, and urethritis diseases. That's chemical foods. So before you get prostate, straight away, you are going to have from the kidney to the urethra to the gallbladder, then to the manhood. These are the 4 areas that you get the prostate. So it comes straight from the kidney. Without the kidney, you won't get prostate problem. And we are going to expand a little. Prostate cancer, first you experience bad odor when you are urinating. Then you experience pain in the shaft, that is the manhood. You also experience pain during urination, and then also pain in the ground, that is the tip of the shaft. Then also pain urinating during midnight, rampant urinating after midnight, excruciating pains during urinating. You forced to urinate about 2 or 3 times before even it comes out. You also rush to urinate. And last but not all, there's odor in the urine. Now, petrochemicals food that causes prostate cancer. First, let's look at smoked fish, followed by hypertension drugs, followed by oily fish, that is fish that consists of oil, plenty oil. Then fresh fish, processed, that is processed foods, natural and artificial spices, food colors and flavors. Now going to the smoked fish. All smoked fish on the market have been preserved with formalin. That is what they use to preserve the dead bodies. They have used to preserve the smoked fish. So the smoked fish can be there for 2 years without going bad. So in other words, this preservation will stiffen your veins, whether you are a man or a woman. So with the women, we are told that in America, 50% of women wear panty liners because the urine will be coming and you don't know why. The same applies to the men. Definitely when you are a man, it will give you prostate. So formerly in smoked fish, when they smoke the fish, they put the formalin in a paper or if rack under the basket, pack the fish on it, tight it within 24 hours. It has done. For it can be there for 2 years without smelling. So if you eat formalin, you are bound to have prostate. Then we come to hypertensive drugs. Some you take within 1 month. Once you take and your urine is smelling, you have to stop. Otherwise, straight away, you get prostate. Then preservative on oil fish. You say, oh, eat oil fish, oil fish. The moment you eat, they are more higher than the one without oil. So preservative on oil fish is very high. Then preservatives for fresh fish. Now you don't get fresh fish as natural as it is. Any fish that you caught on the sea and spends more than 12 hours is preserved before it is landed. Then when it is landed and it's smoked, it is also preserved. So all these are petrochemical preservations and they will have effect on the body and then on the bladder. Then processed food, we have to look at it. Any processed food, because it has been preserved, you will get processed. It is from petrochemicals. Any petrochemicals directly affect the kidney, and there the process starts. Then artificial and natural spices. Even natural spices have effects. How much more artificial spices? So we have to be very careful about the spices that we use. And for artificial spices, don't go there at all. Now we also have food colors. You have your food being colored, and then also food flavors. These flavors and colors are half phytochemical products. If you eat them, you see. You take these small biscuits. This, if you don't have prostate, you don't understand. But anybody who is having prostate, if you let him buy just a biscuit in town, small biscuit, even a 2 cedis biscuit, 5 cedi biscuit, and that very night he will not be able to sleep. Now mentioning this very uh, stage, I'm saying, if you take that of smoked fish, we have about 19%. You take the hypertensive drug, some have 19%. Then preserved oil fish, 16%. Then you come to fresh fish, 15%, 13%. You come to preserved foods, it's 13%. Natural and artificial spices, 11%. Food colors, 5%. And food flavors, 5%. Now also, we also have types of allergic persons prone to urethritis and prostate. We have seafood allergy, that is salted fish and salted meat. Any salted fish and any salted meat. If you are a prostate person, don't touch it. Then pollen allergy, that is honey and the rest. We come to chemical food allergy. Any food that has been chemicalized. Then drug allergy. And last but not least, this injection allergy. Any person with these allergies will get prostate if he eats this type of food I mentioned earlier. And then also food that aggravates the veins of the pains of a prostate person. Food that aggravates, because you don't know, you go and eat the food before you the next day you have to rush to hospital. These foods include ginger, corn porridge, orange, yam, cassava, unripe plantain, cocoa, that is cornflakes that we call gari. Then you have coconut water, pineapple, roasted porridge, corn porridge, and lipton. These are foods. If you are a prostate cancer patient, don't touch it. And as for biscuits and the rest, don't hold it at all. Otherwise, you are going to aggravate your problem. We don't, adodo and dodo, we treat prostate as easy as that. You don't need, even if you are on catheter, you will remove it within 2 weeks. We treat all these prostate. Not only prostate, we treat stroke. We treat pressure, we treat diabetes, we treat lymphedema, this swollen legs and other things. Talk of infections, sexual transmitted infections. Talk of kidney problems, we treat everything. Talk of what do you call it, any phlegm issues, we treat everything. Adodo and Dodo, we check you, we, we we find the cause of the problem and we treat it. The root cause is very paramount. Every food that you eat have a cause. We check this, treat you, advise you on your food, and that is all. When you are sick, it only means that you are eating wrongly. And so, by addressing it, we give you the medicine and show you what food is causing so that you will jump out of it. You are welcome to Dodo and Dodo. Check on our other platforms and you'll be well served. Thank you.